Equal access to healthcare should be a human right within all cultures. Hi, my name is Erik Rotger, and my topic today is culturally safe practice effective communication in Aboriginal and Torres Strait Islander health. I'll begin by explaining that Nature describes the concept of Aboriginal health as a whole of life view, and not just about physical well-being and absence of disease or illness. It is a holistic concept that includes social, emotional, cultural, spiritual well-being, not only for the individuals, but the whole community. It also has been recognized that large inequities exist in Indigenous health across all statistics and contrast with non-Indigenous Australians, and that they are significantly more likely to experience poor health outcomes. Enhancing health and well-being of Indigenous Australia continues to be a long-term challenge for our government. There has been very little progress in reducing the inequity gap over the past decade. Statistics for 2015 and 2017 reveal that there is a life expectancy gap of almost 8 years for female and 9 years for males between Indigenous and non-Indigenous Australians. The young age structure of Aboriginals and Torres Strait Islander population also means that illnesses currently being faced are expected to increase in the coming decades for all age groups below 65. The age-specific death rate for Indigenous Australians are at least twice those experienced by non-Indigenous populations. Contributing factors of Indigenous health inequities include the absence of equivalent accessibility and availability to primary healthcare. It is as well as care being culturally tailored to and appropriate to the needs of the client. Other attributing factors, as stated in Closing the Gap, report the lack of commitment and responsiveness of our healthcare. My next point shows that there is a need for cultural safety and practice and effective communication as an integral component of nursing to achieve quality healthcare and the potential for better health outcomes. Culturally safe means creating a setting that is secure, for Aboriginal and Torres Strait Islander individuals and enhancing personal empowerment over their care. To deliver culturally safe care, we must first start with the cultural awareness, which is the beginning step in understanding that there is a difference. Next, moving to cultural sensitivity, which is the start of self-exploration and acceptance of cultural differences without prejudice. And finally, cultural safety is the next step in the process and is an outcome of attaining cultural awareness and sensitivity. Cultural safety should be considered an ongoing educational journey and pursuit. It is a dual benefit in improving professional nursing practice as well as improved holistic care received by the client. Effective and open communication is a key factor in developing strong therapeutic relationships. It involves asking open-ended questions which allow a space for the family and the clients to raise questions that they would like to discuss. It also helps clinicians to understand the need and the kinship system of the family. Elements of effective communication include active listening, a patient-centered care approach, and being attentive and visual and non-verbal clues. This is particularly important where there are differences in language being spoken between the client and the nurse. In response to the colonization and negative historical and present-day interaction with the healthcare system, Aboriginal Torres Strait Islander people may view the healthcare system with distrust. This is substantiated by the fact that in 2018 and 2019, 32% of Indigenous Australians did not access healthcare when they needed to express it was due to language barrier. discrimination, and cultural inappropriateness. Further, between 2018 and 2020, emergency department and hospitalization leave events occurred more frequently in Indigenous presentations as compared to non-Indigenous by as much as 3.1%. There are as many things that act as barriers and inequitable healthcare, and sadly, many of them are easily improved. In relation to the role of the midwife and the healthcare of Indigenous Australians, we know we are obligated to operate within a code of conduct such as the ethics and the NMBA code of conduct, the nursing code of conduct, which was updated in 2018 and provides specific guidance around working with Aboriginal and Torres Strait Islanders. Applying the nursing code framework in nursing professional healthcare and nursing professional helps to support the differences, delivery of respectful, cultural, and safety, ethical, suitable practice. The nurse can continually pursue cultural awareness and apply their learnings into their profession and advocate and educate others, which is a benefit to the healthcare system culture. While there has been improvements in some measures of Aboriginal and Torres Strait Islander health status, they have not matched the rapid health gains experienced in the general population in Australia. The focus should be on an analysis of the gap delivery of quality holistic care, continuous quality improvement, with the aim of identifying strategies that could be implemented in improving cultural safe practice. There are some easily accessible strength-based strategies you can personally employ to immediately improve the cultural safe practice. The nurse could avoid using medical jargon, acronyms, as well as terms depending on the client's capability to interpret care. Familiarize yourself with workplace cultural protocols, as well as seek out resources that are tailored to Aboriginal and Torres Strait Islanders. Access cultural awareness training and actively apply your learnings in your role. Advocate for training to be readily accessible to all staff, such as via e-learning, and continuing to enhance cultural competency across healthcare settings. Accessing an Aboriginal liaison officer can help communication between the nurse and client and help client understand the medical procedures in their healthcare setting and support them participating in decisions making relating their care. Thank you for listening to my presentation. I hope some of the points raised resonates with you, and you can see how everyone in the healthcare system can play a role in supporting enhancing cultural competency in our hospital and broader healthcare setting. Thank you so much.